So whether the clinicians within a hospital identifying a patient or patient and family who would be perfect to be a voice for this, or an advocacy group?
Both. We do both.
Okay, great. Well, that leads to one of the other discussions. You're building these models, whether it's around the birthing, around breast cancer, and you've partially answered this already, but who needs to be consulted? Who need to get involved maybe around this table as you're developing the model, including the payment part? What's crucial for success?
Internally for the hospitals, that's the first step. I think there's the patients, of course, and the different specialists and nurses. I think that's really important, and it's sometimes difficult because they don't have the time for it. Of a specialist that treat the patient in this for breast cancer, like internist, a surgeon, etc. But also radiology, sometimes even pharmacists. So that's the internal part, but also I think for contract is the sales department, of course, health insurers, and more we're making the dialogue with the health insurers to really connect on the contracts. But stage before that is about how are we going to improve, what is our aim to improve in the healthcare, and I think that's much more a dialogue between health insurers and the hospitals. What we are building. For example, with Silver Cross, we're building that, and it takes time to trust each other, to understand each other really good. Because you really have to go into depth sometimes for breast cancer, what's the real problem. And also, insight we gain is also like for health insurance, it's not feasible to connect with each healthcare provider individually in the Netherlands. I mean, there'd be huge healthcare networks to all have that kind of relationship with all the different healthcare providers in the Netherlands. So it has to be scalable for them from a perspective of administration and etc. So that's, I think, really to understand each other much better on what are your own difficulties from your own role in the healthcare system.
So because you are such a big stakeholder in the provider community, do you find that a big insurer, CZ, Silver Cross, Mensa, that they're having those discussions? Because it sounds like you're bringing the proposal to them. You're saying, here's what we see as a need, here's how we want you to partner with us.
I hope it's a dialogue in that way, but I think we take a lot of an initiative, I think, because we have set on this course of making steps in the healthcare, and we're doing it already for 10 years, so I think we have some experience in it. But still we're learning a lot, and especially with the health care insurers, I think we have good dialogues with a couple of them to have this journey, I think, together much more. So.
How does that connect to the scalability problem for them that you mentioned? Just do they look at you as the big dog, the lead player, and if they can get something with you, then it can roll out to all the smaller players easily?
You should ask them probably that question, but I think I can relate to that model. I think we are organized and structured in a way that we can provide first step in making something not work in one hospital but in 7 hospitals. And then perhaps setting the stage for the rest of healthcare providers. So that I think that's one thing that we think is really important also in our role. But I mean, it's not always our position, I think, to claim that.
One entity we haven't really talked about. We've talked about the insurers, the different providers, including the nursing staff, the hospital representatives, coming together to decide what are the quality initiatives that we need to pursue, and then how do we attach money to that. What about on the policy? I'm sorry, the policy. Are there governmental entities that you bring to the table to bring into this conversation, or you keep it only among the private entities?
We do a lot of discussion with also the government, with the Department of Healthcare. Yeah, I think that's really important also but that's the debate, what is their role in it? They have the facilitation role or more or less legislation-wise. So that's, I think, that's a debate is going on, I think. But it's really important to make that connection. Also, I think it's really important to connect the legislation and the changes from the government for payment models and the room they provide for it. That they have to connect with what our experience is in the daily practice. I mean, you have a macro level, you have to connect it to what's the problem in the healthcare itself, and not only hospitals. But for example, in a national level, we say we want to implement PROMs, patient reported outcome measures, for the whole country. And that sounds really nice, but if we do the daily practice, we're daily struggling with it. It's a lot of work. The IT doesn't work, costs a lot of money, and what you're going to do with it. And that's the question you need to connect. Okay, what's your aim with implementing prompts nationwide in the relationship with the patient and the specialist to discuss their results? So then it will change the healthcare process, or is it for the population level needed to see what is the difference between quality of life between breast cancer and so the health economic kind of perspective. So that's really why you want to use prompts, and that's an example of legislation. You have to connect it. Why are you using it in the daily practice? And that's, I think, we can discuss and provide a lot of input on our vision about it with the governmental side of it.
If I understood correctly from another interview, and we're talking about RIVM, right? The National Health Agency. Haven't they mandated some alternative payment arrangements for some of the conditions, like the maternity bundle? Isn't the maternity bundle mandatory now nationwide?
No, that's the debate going on nationwide. But
okay.
It's NZA, I think you mentioned. But it's that's the exploration of is it mandatory to, and how does it really work? I think it's quite difficult. But it's also about the whole chain of care, and it's not per se about value-based healthcare. That debate, because then you have to define what is good care, and that's not always defined yet, I think so. But that's also an example of how you have legislation and how does it connect with the care provided. So.